So when we think about epilepsy and its and seizures and the related risks, part of that risk reduction and those strategies and those things you can put into place to reduce your risk of epilepsy-related harm can actually, knowing your triggers can actually help you to put those things into place. So how many of you out there know your triggers or have identified some of your triggers? Yeah. So for yourself, for example, what would be some of your triggers?
Alcohol, lack of sleep.
Yeah. And yourself?
Yeah, the same.
Yeah. And was someone over here?
Kids.
Yeah. So bit of lack of sleep and stress.
Lack of sleep and too much caffeine.
Yeah. Yeah. And over this side?
Stress and liquor lights.
Okay.
Focus sensitivity.
Yeah, for Christmas, I don't like Christmas.
Okay. Yeah. Yeah. So yeah, you don't go out and do all the Christmas lights and things, and because
they've got.
Yeah, and because you've identified that risk, you've been able to kind of, recognise that trigger. You've been able to then go, okay, well, I can minimise my risk by avoiding these certain situations. Yeah, and then there are others who maybe haven't recognised any risk. Anybody here that hasn't been able to identify a risk? Oh, you have?
For my son, the change in the seasonal now, where you go from a warm day to a cool day.
Yeah.
He'll stay close to home. That's his main risk.
Yeah. And for some people, haven't recognised any risks. What were you going to say?
Yeah, mine's lack of sleep, but it's
Okay.
Sleep on the day before the hormone usually feel really sick.
Yeah, it's interesting, isn't it? But see how often sleep has come up there as well, sleep and stress. So yeah, just by identifying those triggers, it can help you to put those strategies into place to manage those risks. So sleep or lack of sleep, disrupted routines, stress, excess alcohol consumption, missed medications is another big one as well. So yeah, a way you can kind of, if you haven't already identified some of your triggers, one way that you might be able to do that is by keeping a seizure diary, or keeping track of when your seizures occur, what time of day or night they're happening, what you were doing when the seizure happened. And yeah, if you do that, over time you might be able to then identify some patterns. Were you going to say something too?
Sensitivity, and it used to be the ceiling things under the lines.
And that's been picked up on an EEG?
So it'll be like the typical, and also if you go driving through the forest, you
Yeah.
so it's a straight thing.
Yeah, and reflection through leaves and off the water. Yeah. Okay, so we're just going to touch on stress first of all. I'm just going to touch on a few of those issues, and then we can look at maybe some ways of reducing those triggers or the risk associated with them. So stress, commonly reported, as we've just heard. Tolerance levels in people are all different though. So scientists aren't exactly sure why for some people stress will trigger a seizure and in others it won't, sort of those different thresholds. But stress can also cause changes in a routine that then can make seizures more likely. So you're more likely to be, forget to maybe take your anti-seizure medications. Also, it can contribute to sleep disturbances. So regular routine ensures adequate sleep, medications are taken on time, and also, factoring in some time for self-care as well. So time for yourself to do the things you enjoy can also help to reduce your stress levels. So consider having weekly schedules, using calendars, diaries and apps, things like that, and reminders on your phone. So as I just touched on already, it's important that you try to engage in some self-care as well. Get out, take the time to do the things you enjoy. Use relaxation strategies if you've found that they've helped you in the past. Incorporate some kind of suitable exercise into your regular routine, and just make healthy lifestyle choices. Seek support. So it's also important if you are feeling overwhelmed that you reach out and you seek support from somebody that you trust. So whether that be us, going to your doctor, seeing a psychologist, talking to family and friends. It's really important to try and just get that support and get it off your chest if something's worrying you. So sleep. So sleep's another one that we often find people have reported does exacerbate their seizures. So it's really important that we try to get enough sleep and make it routine. So try to go to sleep the same time of at night and wake up the same time each day as well. Without that adequate rest and sleep, we are more likely to have seizures. Also, when you break a routine, so you've got lots of events coming up, maybe this time of year, you've got Christmas parties and socialising a lot more and that type of thing. So again, routine's really important. It's been sort of found that during those busy times of the year, Christmas, birthdays, celebrations, people do break routines a bit more, which then can have an effect on their sleep patterns and their routine. So bear that one in mind. Medications. So really important one. If you've been prescribed medication, it's important to take the medication as prescribed by the doctor. 7 out of 10 people actually will achieve seizure control through their daily anti-seizure medications. So there's over 30 different anti-seizure medications out there, and the doctor will have selected the one that's best for you based on your seizure type and your history and that type of thing. So when a doctor does recommend a medication that provides you with some seizure control, the benefits usually will far outweigh the risks. So there can be some side effects as the same with any medication really, but those side effects can settle down over time as your body adjusts to the medication. So at the end of the day, seizure control is the goal. So trying to keep that in mind. Some tips for taking your medications. So we want to make sure that we're always taking our medications as prescribed at the same time of day every day. Because when we do missed doses, if we're doing that regularly, that can increase our risk of seizures as that level of medication in the body can fluctuate. So try to purchase the same brand of medication each time as well. Different brands can contain slightly different ingredients, so we want to make sure that we're purchasing what the doctor has actually prescribed for us. And not switching if we can help it. Also using alarms, so reminders and alarms and things like that, apps to remind you to take your medication each day is another tip. Make it a routine, maybe taking it in the morning with breakfast or at night with dinner, the same every day so that we're not forgetting. You can also get dosette boxes or Webster packs from your pharmacist. They can organise that for you, which is another prompt to help you to remember to take your medications. So alcohol and other drugs. So I won't sort of go into it too much. I know that Dr. Dunn did speak about this already, but yeah, use of alcohol often linked to staying up late and can really exacerbate seizures. It can cause you to break routine, affect your sleep cycles, all of those things. So when we consume excessive alcohol, we're more likely to miss our medication, take it at the wrong time due to those upsets in our routine and sleep patterns, forgetfulness, hangovers, etc. Alcohol can also interfere with the way your medication is absorbed in the body. So that can potentially reduce its effectiveness and cause those seizures. Always check with your doctor before consuming alcohol and try to keep it to the recommended levels. So no more than 10 standard drinks a week or 4 standard drinks on any one day is the national recommendation, although you need to talk to your doctor about that as well. But yeah, just know that those effects are there. No recreational drug is harmless, and many are known to increase the risk of seizures. So there's little known about the interactions with anti-seizure medications. Obviously not a lot of studies done in that area, but they are known to increase seizures. So exercise. Studies have shown regular exercise provides us with the physical and emotional benefits, but also may play a role in improving your seizure control. So symptoms of depression and anxiety can also be reduced through all those feel-good chemicals when you exercise that are released, can improve your sleep and cognition and just your overall quality of life. So just when exercising, we've put together a few steps just to make sure that you are putting yourself in the best and most safest position possible. Make sure you get your all clear from the doctor before starting any new exercise regime. Start slow, work out with a buddy. Consider wearing your medical jewellery if you are exercising, particularly if you're exercising alone. Remember to stay well hydrated. Diet, hydration, all of that is also really important to help with seizure control. If you do intend to join a gym or already attend a gym, it might be a good idea to just make the trainers around aware that you do have epilepsy so that they can then are better equipped to respond if anything happens. Have an epilepsy management plan. And avoid using the treadmill alone if your seizures are not well controlled. Never swim alone, and don't swim at all if you've missed your medication or you've had a rough night sleeping. Thinking ahead about those kind of things and not putting yourself in that position. So if you're at a public pool or there's a lifeguard on duty, again, making them aware of your epilepsy, they can keep a bit of an extra eye on you as well. So dietary therapies, Lakshma did touch a little bit on this as well, but studies have shown that diet can help improve seizure control in some people who have epilepsy. So a lot of the studies have been based on the ketogenic diet in more severe forms of childhood epilepsy. But then there's also studies around the less restrictive diets such as modified Atkins and low glycemic diet as well. Some people have had success with those ones. Some people are more likely to have seizures if they miss meals and have low blood sugar levels. So diet is quite important. Maintaining that diet and not having those ups and downs of the blood sugar, blood rising and falling in your blood. It's important to drink adequate amounts of water, make healthy food choices, and have a really have healthy hands at snacks and things at hand ready to go. So any dietary changes that you do want to give a try, make sure you speak to your treating doctor about it first, get the okay with them, because a lot of them do need to be done under supervision. And it's also a good idea to maybe speak to a dietitian or somebody that's experienced in that field before you go and take it on board yourself and do it yourself. So also just remember diets are used in conjunction with other treatment strategies and not as a standalone treatment. So if you're on anti-seizure medications, you still need to keep taking your anti-seizure medications if they're prescribed. Another area to look at that might sometimes be overlooked is work. So what kind of work do you do? Is that maybe a source of stress for you, or you're not sleeping well because of shift work and that type of thing? So take a look at the type of your work you do in the first place. Shift work can cause or pose a risk as well, a safety risk for people. From a legal standpoint, You don't necessarily need to disclose your epilepsy for many positions. That may be a choice that lies with you, but you do have to take responsibility if you choose a job that proves risky to yourself or others, should you have a seizure. So just think about all of those things when you decide whether to disclose or not. There are some occupations, though, that you do need to disclose your epilepsy. So commercial driving, truck driver, bus driver, pilot, some of those kinds of professions you will need to disclose. Again, driving I won't touch on too much because Dr. Gaitatsis already spoke in depth about this. But if you do have epilepsy, you may be able to hold a conditional car driver's license or a learner's permit if your seizures are well controlled. There are laws about driving after a seizure or after an epilepsy diagnosis. People who have had a seizure are required to notify the licensing body and stop driving until approved to do so. You must continue to take your anti-seizure medications if they've been prescribed, and make sure you do get adequate sleep. Don't go out and drive if you've had a bad night's sleep the night before. So I'll just pull up the homepage of Austroads. So that's the current homepage of the Austroads website, and there's a tab there for assessing fitness to drive. So if you go to that website, you'll be able to have a look at the different criteria and what they actually look at when they are assessing someone's fitness to drive. So they've got some little diagrams and possible sort of pathways there. So for seizures, what the process is, epilepsy treated for the first time, there's lots of information on there. Okay, some other steps to reduce the risk. So we have got a talk on SUDEP on our website. So if you want some more information on that, we've got some recorded online seminars on our website on SUDEP that you can go and have a listen to. But SUDEP is sudden unexpected death in epilepsy. It's when a person with epilepsy who is otherwise healthy dies suddenly and prematurely and no other reason for the death can be found. Approximately 300 Australians are lost to epilepsy every year, and half of those are thought to be avoidable. Deaths attributed to SUDEP often happen at night, go unwitnessed, and there's usually signs that a seizure has occurred. Research has shown that it's often associated with missed medications, uncontrolled or frequent seizures, generalised convulsive seizures, and nocturnal seizures. So if we can identify our triggers, that's just one step to reducing our risks. We want to try to avoid drinking too much alcohol and use of illicit drugs, making sure that we're getting adequate sleep, taking our medications as prescribed. Also, remember to try and train your loved ones in seizure first aid and the people around you. It could be carers, teachers, workmates. Make sure they know seizure first aid. Incorporate the use of appropriate seizure alert devices as a part of your overall risk reduction strategies as well. And we'll talk a bit more to that. And make sure you've got up-to-date epilepsy management plan as well. There is a section in our epilepsy management plans. Section 8 actually has important information on risk that you can include in that. So this is just another screenshot of our website. And if you go to the website, Epilepsy WA, you'll be able to download and print those care plans direct from our website. This is just an example of an epilepsy management plan, our epilepsy management plan that you can get from the website. And they're great because they're so detailed. So they've got loads and loads of information on them, from diagnosis, seizure type, what the seizure might look like, whether an emergency medication has been prescribed, any particular risks, triggers, that type of thing that you've been able to identify. You can list it all in there. Also on our website, we've got Dr. Lawn's informative talk on SUDEP. We've also got Dr. Gaitatsis. He's recorded an online seminar all about epilepsy, pregnancy, and family planning, which is another valuable one. And we've also got talks on seizure alert technologies, epilepsy and sleep, lots of different topics. A couple of new resources we've also recently produced are risk reduction strategies. They're outside on the table. I'm sure you've probably all already seen them out there during lunch. But there's got some handy tips on there on how to reduce your risk around the home. So just some different things you can put into practice around the home to reduce the risk, and some also just for out and about, other considerations. And we've also got seizure first aid strategies as well. So they are available on our website, but there is also some outside. Thank you for listening.